Welcome to the podcast. My name is Grace, and today we're joined by the lovely Dr. Nguyen, who is an associate professor of epidemiology and biostatistics here at UMD, and she directs the Big Data for Health Equity Research Collaborative, also at UMD, and conducts research on the impacts of various social factors on minority health and health disparities. So, welcome to the podcast, Dr. Nguyen, and thank you so much for agreeing to speak with us today.
Well, thank you for inviting me, Grace, and thank you for the introduction. That summarizes well my research areas.
Well, yay, I'm glad, and yeah, really thank you so much. We're really excited to learn from you today. I guess my first question for you is, since your research revolves a lot around racism and minority health, I just wanted to understand what brought you to your field of research today.
I've been interested in health disparities for a long time. I remember my first exposure to health disparities was in my freshman year at college, and it was a class taught by a medical sociologist and a pediatrician, and then he was presenting studies on how like poverty and the neighborhood built environment impacts health and how they're like quite wide disparities between various social groups. And I was like, wow, this is amazing. There's like a career where you can like study and then kind of make a social difference. So then my first class, I think, captured my attention interest. And then since then, I've been interested in health disparities. I made my concentration in health disparities and then asked the professor to be my advisor. So then it was like since then I've been interested in this field. And I think the kind of the research that we do when we talk about differences, a lot of the research doesn't name the causes, right? It just says like, oh, look, there are these differences and it got worse. Or like, or like there are other differences here. But then I like the area of racism because it particularly names like a fundamental cause of health disparities. So then I feel like there's some action or movement. And then there's kind of examining more of the foundational causes driving health disparities. So I think that that part is particularly exciting. And then it's, you guys started looking at racism several years ago. I forget how long now, but yeah, but it is on the pathway to health disparities, kind of looking at more root causes.
Wow, yeah, that sounds really cool. I can relate to the idea of a medical sociology class because I'm actually taking one right now. And I've also been like, that's really cool. So I think it's really interesting to learn that your interest was also sparked by a medical sociology class. And I guess also, as the director of the Big Data for Health Equity Collaborative, can you also tell us more about big data? And you were mentioning how you are able to name racism as like a cause in your research. Can you explain maybe how big data is able to help you better examine the social determinants of health and maybe racism?
Oh, thank you. Thanks, Grace. Yes, that's also another thoughtful question. Let's see. Um, Yes. So one of the big data sources that one of the main ones that we study is using social media data. And particularly we use social media data to try to tap into cultural racism. Um, I think in the scholarly work and news press, there's been more attention to structural racism, and that's super important, right? It's like the relationships between institutions and how they reinforce one another, and support kind of like this interconnected system that supports health and equities, by policies and programs and laws, right? Structural racism. But then like that cultural racism is also very important because it forms the social context. Um, there's been scholars that done like a really good job trying to explain cultural racism. Basically, it's like the norms, values, imagery, kind of implicit assumptions within society and institutions. So you can imagine how kind of these implicit norms and biases can support both like all forms of racism. It can support internalized racism. It can support like personally mediated racism, like how people treat one another, and then it becomes formulated and formalized in laws and policies, right? So then cultural racism helps to kind of form the the ambiguous uh kind of air that makes it more tangible in the laws and policy. So I like to study that, and then I say that through expressions of through language, and usually we study racism or experiences of racism and discrimination by asking people like their to report kind of discrimination. But of course, like that can only reach some people and some people are missed. And also it might be hard for people actually to report or remember due to a variety of different things. Like they might not remember or they might feel they don't want to report it and cause friction or a whole bunch of things. But then on social media, people talk about things every day on a number of topics. And then so I think it's like a robust way, a rich data source to capture how people's beliefs and attitudes um, are changing over time and place, kind of a way to capture the social context and measure how people talk about different marginalized groups. So that's how I use kind of big data to tap into that amorphous concept.
Wow, that sounds really cool. And I guess also thinking about it, what you were saying made me think about with in regards to people reporting racism and how you were talking about internalized racism, it made me realize, wow, like some people might not even process something as racism if they've been internalizing something like that. So in that case, I think also analyzing social media is really, really cool.
Yes, we conducted focus groups of like women of like who were either had children or who were thinking about having children in the future, and we conducted different groups like Asian Pacific Islander, Black women, Latina women, Middle Eastern women, and then one of the things we noticed was that for Asian women, when we asked them, "Do you experience racism during your pregnancy?" They would say no, but then other groups would say yes. But I think it might be due to acculturation or not explicitly thinking that those experiences or those events were discriminatory. So it might be, yeah. So I think like different cultures also kind of process and identify kind of experiences and events differently. But yeah, kind of finding more culturally appropriate ways to even ask those questions would be important. Yeah.
That's really interesting, and that sounds like a really cool finding that your team was able to find. And I guess also one thing of note, I've seen that some of your studies revolve around an area level measure of racism or racial sentiments through Twitter. And I also just wanted to understand how you developed that and how has it impacted how you're able to operationalize racism?
Oh, yes. One of like the strengths of some social media data is that there is some location information. Um, so it used to be, well, Twitter used to be accessible to researchers like as a free data source, and there would be like a public API as well as an academic tracker for researchers. And then within that, a proportion of posts has location information, and then from that, we're able to figure out where the post was sent. And then so we would analyze posts and then summarize and create averages of kind of the sentiment of posts referencing like Asians or referencing Black people or referencing Middle Eastern people or referencing Latino people. And then we aggregated by the county or the state. And then this allows us to merge with public health data sets, for example, or health data sets in general. Like we merged it with the birth files. So we're able to look at the association between negative racial sentiment for specific minority groups and in birth outcomes for those groups as well as the total population. So that gives us kind of like the opportunity to look at does racial sentiment at a particular time and place, is it associated with health outcomes in that area? Um, so yeah, and then that's just for not all posts have location information, but then for the posts that do, then we are able to link it and create those measures.
Right, that sounds really interesting. And I know you also mentioned towards the beginning that Twitter used to be a like good place for public health research. How I kind of want to understand how has that changed, and has that shifted your team towards looking at other social media platforms?
Mhm. Yes. Um, Twitter used to be one of our big data sources, but now we still use it because we've collected a lot of data over the years. And so we still use it to look at more outcomes or additional analyses. But we've also expanded to different, like to Blue Sky. They have like a public API that is free that we can collect. We also collect Meta, which um, like that's Facebook and Instagram data. Meta has created a dashboard that's also it used to be CrowdTango, but then they transitioned to like another dashboard. But that's a tool that researchers can still use to analyze. So now it's Facebook and Instagram data and Blue Sky are still available to researchers and the public broadly for research. And then Twitter is available, but it's very expensive, so you have to kind of pay for data access for that. Yeah. And then one neat find that we did get from the Twitter data was like, for the area level sentiment measures. So we found that uh, areas or counties and states with higher negative racial sentiment, referencing racial ethnic minorities, had higher risk of preterm birth and birth outcomes for like the total population. And then also Black sentiment, more negative Black sentiment is worse, has those places have worse birth outcomes for Black mothers. But we also found that negative sentiment for racial ethnic minorities is associated with worse birth outcomes for white mothers too. So then that's kind of neat because it kind of talks about, kind of suggests that negative racial sentiment referencing minorities is bad for the population in general. And then when we looked at negative racial sentiment referencing white people, it wasn't associated with birth outcomes for white mothers. So it was really minority sentiment being associated with worse birth outcomes. So that's kind of neat. So it's kind of neat to find these kind of associations. And then we did it for single years as well as multiple years across 10 years. And the associations were stable. So that yeah, so that's kind of neat. One of our more interesting findings.
Yeah, I don't think I would have imagined that negative minority sentiment kind of impacts everyone in the population. So I think that's really a really neat finding.
Yes, I think there's like more some research talking about how racism impacts both the advantage and disadvantaged groups. But I think it'll be good to have more research on that. Because I do think white folks also suffer disadvantage from racism, and that is could be talked about more. Yeah.
Yeah, for sure. I guess also with that, what are like the sort of main takeaways from research, or what do you hope the impacts of your research on things like health policy or maybe health professionals to be?
Yeah. I think one of the takeaways is um the field of health disparities and looking at racism and social drivers. I think it's because we're dealing with society and all the complexities of society, it's kind of really challenging, but also very exciting. And then kind of this research helps to remind people that kind of to look at creative solutions. Like when we think of health data or public health data, sometimes we think of like, oh, clinical trials, like electronic health records. We must ask the participants a survey or like conduct focus groups. But I think there's like lots of different ways to do research and lots of different ways to kind of advance the field. So I think like maybe one takeaway is like you can be creative and you can still kind of push the field forward. Um, and I think kind of one of the other takeaway is that, of course, humans are social beings and we exist as a society and a culture group, and that has implications for our strength as well as our risk and kind of, yeah, collaboration as well as hostility and friction. Like I feel like that's kind of exciting part. But then in the finding, right, the problem can also be like in the right because if expressions of hostility is bad, what happens if we use it to promote kind of understanding and then promote different groups' values and strengths and contributions? I feel like yes, and then social media is a way to disseminate so much information so quickly, but it can also disseminate positive positive things. So I think like it's like a double-edged sword. It's like a powerful tool both ways.
Yeah, I can certainly see that with like, um, I feel like there's been a lot of messaging maybe both ways with social media. I feel like I've seen a lot of posts lately about like stereotypes, but I've also seen a lot talking about like cultural appropriation, so like the other side of things. So I think it's really interesting that you're able to appreciate social media as like a double-edged sword.
Yeah, it's not like completely bad or completely good, but I think it could be used definitely for both.
Yeah, certainly. And I guess so. Last question. As you've mentioned, social media, um, I guess being able to see social media as a double edged sword, how else would you say your research has impacted you as a person?
Yeah, um, I really like it and appreciate because it allows me to kind of constantly kind of grow and learn and then also to collaborate with people. Like for example, like the big data for health equity. I think one of our great strengths is that we have students and we have faculty members both at UMD and then across different universities. And then the folks that we have are some people are still epidemiologists, but we also have qualitative researchers, computer scientists, um, just a range of people interested in different things and having different expertise. I think being able to learn from one another and do research that we wouldn't be able to do by ourselves, like to do even one paper, right? There has to be a data science that collects and cleans the data. Then there has to be a person that knows about theory to kind of conceptualize a research question and then design the study and then run the analyses and then write it up. And then a lot of our papers use mixed methods of quantitative, machine learning methods, as well as qualitative. So I think like one of like, yeah, the opportunity to keep learning and growing. But also because this is a career that I want to be in for the long term. It also, and then because research never stops, you kind of also have to learn sustainability and when to kind of give yourself rest and kind of balance. And then when to be like, oh, this is the moment where we have to like really push because it's such an important historical moment. So there's times where you like um we we really try to do timely papers, and then there's other times when like kind of nurturing each other, taking care of one another is also important for long term, being able to stay in it for the long term. Yeah.
Wow, yeah, I can imagine, especially when you look at all these like racial sentiments on social media, having to have that sort of balance. And also, I really like what you're saying about collaboration and how much collaboration is involved for each sort of product or project. And I can imagine that with all the creativity involved in your studies, with all the various social media platforms you analyze, a lot of collaboration has to be involved.
Yeah. Yeah, even just the visualizations and then yeah, but yeah, it's but it makes it fun too because then we get like to create like a little community.
Yeah, that sounds awesome. Do you have any, I guess, like final things you want to say to our audience?
Oh, yes, I think if folks have questions or are interested in learning more about my research, I think Grace, you can like share my email with them and then they can contact me if they have follow-up questions. Um, but yes, I think sometimes, we've experienced in the last year, right, a very like kind of tumultuous time for kind of even being able to say diversity or or and then there's so many different issues at play like immigration and education and then being able to say people's like the history. So I think sometimes it feels like very like, oh, this is this is a hopeless time. But no, I feel like this research is still needed and is important and doesn't make it less valid. And it's perfectly okay and needed to keep going and recognizing that, yeah, I think like in the long term, um, this would be a historical moment that would be important. And that even though sometimes it feels like stressful or hopeless, I do feel like underneath that there's lots of people working um towards like a more positive social change. So I do think it's still happening. Um,
I'm glad to see that your perspective on, I guess, like all the things that are going on in the moment right now. So I'm glad you're doing what you're doing in research. And yeah, I would say best of luck in your research and to your team as well.
Thanks so much, Grace.
Good. Thank you so much. About one thing about this organization that I wanted to quickly share is for this conference, we wanted things to be very conversational where we can be very personal to one another. And I think this is the first podcast that we're doing with this organization, and we're very thankful that you are able to really share your like perspectives and your insights. And I think the last thing you mentioned in terms of like hope in this in this like season of life is like a very important characteristic that an individual, especially a researcher, has. I think as I am organizing this conference, our main goal is to raise like compassionate and aspiring leaders in healthcare, but even as like to raise inspiring individuals in life. And I think you are an example of that. So I do wanted to just like express my own appreciation for you for this podcast. So thank you so
Oh,
much.
thanks, Joanna. And then, like when I saw your emails, I was like, "Wow, there's like a student organization doing this." I was like very impressed. And then it's very timely and very needed. And then you guys both are like have hard majors, like, and it's like very demanding majors, and you're finding time to do this important work. So I want to say congratulations to both of you, and and like it's very impressive and very important.
Thank you so much.
Thanks, Grace. Thanks, Joanna. Oh, I hope you have a good rest of your week. Thank you. Bye.